Haws syndrome, a relatively common yet poorly understood disorder in cats, is characterized by an acute elevation of the third eyelid in both eyes. Despite its prevalence, very little is known about this condition, including its underlying cause, diagnostic tests, and effective treatments. This insightful research article, published in the Veterinary Record in 2024 by Fruchter et al., delves into the clinicopathological findings in cats with Haws syndrome, shedding light on this mysterious condition. This prospective study aimed to evaluate the ocular, systemic, and gastrointestinal health of cats with Haws syndrome. The study involved 10 cats with acute bilateral protrusion of the third eyelid. These cats were presented to the University Veterinary Teaching Hospital, Koret School of Veterinary Medicine, Hebrew University of Jerusalem, Israel, either directly by their owners or referred by general practice veterinarians. Owners were asked to bring a fresh fecal sample from their cats. The study excluded cats with unilateral or chronic third eyelid protrusion, as well as those with protrusion attributable to other ocular or neurological abnormalities. Detailed information was collected from each owner about the cat's breed, age, sex, neuter status, lifestyle, indoor-outdoor, single or multi-cat household, diet, recent environmental changes, vaccination status, deworming, ectoparasite prophylaxis, and previous systemic and ophthalmic medical history. Given the potential association of Haws syndrome with infectious agents or gastrointestinal issues, questions regarding recent changes in body weight, appetite, gastrointestinal upset, vomiting, regurgitation, diarrhea, and the health status of other cats in the household were also included. Each cat underwent a comprehensive physical examination by the same investigator, including chest auscultation, abdominal palpation, lymph node palpation, and assessment of skin health, mucous membranes, hydration status, rectal temperature, body weight, and body condition score. A board-certified veterinary ophthalmologist conducted a complete ophthalmic examination, encompassing measurement of pupil diameter, Schirmer tear test, rebound tonometry, fluorescein staining, slit lamp biomicroscopy, indirect ophthalmoscopy, and photo documentation. To assess the involvement of ocular sympathetic neuropathy, one randomly selected eye of each cat received a drop of 1% phenylephrine. The researchers then reassessed both eyes within 20 minutes for changes in third eyelid position, palpebral fissure opening, and documented these changes with photographs. Laboratory tests were performed on fecal and blood samples. Each fresh fecal sample underwent microscopic examination for a fecal smear and Giardia duodenalis antigen detection using an ELISA-based test. Blood samples were analyzed for complete blood count, serum biochemistry profile, feline serum amyloid A, FSA, and serology for feline immunodeficiency virus, FIV, antibody and feline leukemia virus, FALV, antigen. All cats received a 3-day course of broad-spectrum deworming using praziquantel and fenbendazole. Cats testing positive for Giardia received an additional 2 days of deworming and a concurrent 5-day course of metronidazole. 1 week after deworming, one randomly chosen eye received standard artificial tears twice daily for a week, while the other eye received artificial tears with tetrahydrozoline HCl, an alpha-adrenergic agonist, twice daily for a week. The researchers conducted weekly follow-up conversations with the owners until the third eyelid protrusion resolved. The study included 10 cats, with a mean age of 17.6 months and a weight of 4.8 kilograms. Most of the cats were mixed breed or domestic shorthair, with an equal distribution of males and females. All cats tested negative for FIV and FALV, and their complete blood counts were within normal limits. However, minor abnormalities were observed in the biochemistry profiles of some cats, including elevated alanine transaminase, amylase, creatine kinase, and creatinine. These abnormalities were considered incidental and not related to Haws syndrome. 2 out of 8 cats tested had elevated FSA levels, indicating systemic inflammation. Ophthalmic examination revealed bilateral protrusion of the nictitating membrane and ptosis in all cats. Figure 1 in the article showcases a 1.5-year-old female spayed domestic shorthair cat diagnosed with Haws syndrome, illustrating the bilateral protrusion of the nictitating membranes and ptosis. Interestingly, besides these 2 clinical signs, the ophthalmic examination was unremarkable, with normal tear production, intraocular pressure, and no significant ocular abnormalities apart from a few incidental findings. Notably, all cats exhibited a positive response to topical 1% phenylephrine, with retraction of the nictitating membranes and resolution of ptosis within 7 to 20 minutes, as depicted in Figure 2a. This transient resolution, lasting approximately 2 to 3 hours, also occurred when owners applied Visine eye drops at home, resulting in temporary unilateral resolution of the ocular signs for approximately 4 to 6 hours, Figure 2b. 4 out of 10 cats presented with diarrhea, while fecal antigen testing for Giardia duodenalis was positive in 4 out of 9 tested cats. However, Giardia organisms were observed on fecal smears in only one of the 4 affected cats. Evaluation of the fecal smears revealed diverse findings, including a heterogeneous bacterial population with or without yeasts in most samples. One sample exhibited suspected Giardia organisms, while another showed dysbiosis characterized by prominent clostridial presence and numerous spirochetes. Haws syndrome resolved in 9 out of 10 cats within an average of 37.7 days from the onset of clinical signs. Figure 3 in the article presents photographs of a 1.5-year-old male castrated mixed-breed cat with Haws syndrome, taken by the owner at different time points. These photographs demonstrate the variability in the degree of nictitating membrane protrusion over time. While 6 of the 9 cats showed no recurrence during the follow-up period, 3 cats experienced recurring signs of Haws syndrome 156 to 182 days after the initial resolution. In the remaining cat, the ocular signs persisted for 197 days. This cat was part of the multi-cat household that became affected after the introduction of an outdoor cat with diarrhea, the same household where the 3 cats with recurrent disease resided. The findings of this study strongly suggest that Haws syndrome in cats is often associated with a sympathetic neuropathy. This conclusion is based on the observation that all affected cats exhibited a positive response to topical phenylephrine, with rapid retraction of the third eyelid and resolution of ptosis. This response suggests denervation hypersensitivity, a phenomenon observed in Horner's syndrome where postsynaptic effectors become hypersensitive to low levels of neurotransmitters due to a disruption in sympathetic nerve supply. However, unlike typical Horner's syndrome in cats, the pupils of cats with Haws syndrome did not appear miotic. This discrepancy requires further investigation to understand the underlying mechanisms involved in Haws syndrome. While the exact cause of the sympathetic neuropathy in Haws syndrome remains elusive, the study provides compelling evidence supporting the role of a contagious gastrointestinal pathogen. The rapid development of Haws syndrome in 3 healthy cats following the introduction of a kitten with diarrhea and Haws syndrome into their household suggests a contagious etiology. This observation aligns with a previous report by Gruffy-Jones et al., where the introduction of a cat with Haws syndrome into a catera led to subsequent cases within the cattery. Although the specific pathogen remains unidentified, the study suggests that intestinal worms are unlikely to be the primary cause, as most cats had received recent deworming, and broad-spectrum deworming did not lead to rapid resolution of clinical signs or prevent recurrence. The study explores the potential role of various pathogens, including protozoa, bacteria, and viruses, in the development of Haws syndrome. Giardia duodenalis infection was detected in 4 cats, including the kitten suspected of transmitting the condition. The relatively short pre-patent period of Giardia makes it plausible that this protozoan contaminated the other cats shortly after the kitten's introduction. However, the absence of positive antigen detection in all affected cats, the lack of rapid clinical resolution despite treatment, and the absence of Giardia detection in previous studies raises questions about its definitive role. Bacterial infection is another possibility, with one cat showing prominent clostridial presence in fecal analysis, and previous reports mentioning bacterial overgrowth in some cats with Haws syndrome. However, the presence of similar bacteria in control groups in previous studies casts doubt on their specific involvement. Viral infection remains a strong contender, considering the self-limiting nature of Haws syndrome. A novel torovirus-like agent was suspected in a previous study based on serology and electron microscopy findings, but subsequent studies failed to confirm its presence. While coronavirus and coronavirus-like particles were observed in fecal samples of some convalescent cats, their role in causing Haws syndrome is uncertain. The researchers hypothesized that a gastrointestinal pathogen could trigger Haws syndrome by inducing dysbiosis in the gut microbiota, which in turn could affect the sympathetic nervous system through the gut-brain axis. Changes in the gut microbiota are known to modulate sympathetic neurons via a complex gut-brain circuit involving signaling molecules and the vagus nerve. This link between gut health and neurological function provides a plausible explanation for the association between gastrointestinal disturbances and the sympathetic neuropathy observed in Haws syndrome. The study also discusses why Haws syndrome is seemingly unique to cats. The presence of smooth muscle fibers in the feline third eyelid, absent in other domestic species, could explain this species-specific manifestation. These muscles, believed to be involved in third eyelid protrusion and retraction, are innervated by the sympathetic nervous system, making them susceptible to dysfunction in the presence of a sympathetic neuropathy. While the optimal treatment for Haws syndrome remains to be established, the study suggests that broad-spectrum deworming may not be beneficial. Targeting the underlying infectious agent, if identified, along with managing the sympathetic neuropathy and addressing the presumed gut microbiota dysbiosis, could be potential therapeutic strategies. Sympathomimetic drugs like phenylephrine and tetrahydrozoline provide temporary relief from ocular signs, but do not address the underlying cause. Further research is needed to fully understand the complex interplay between the gastrointestinal system, the gut microbiota, and the sympathetic nervous system in Haws syndrome, and to develop effective treatment approaches. In conclusion, this study sheds light on the clinicopathological features of Haws syndrome in cats, highlighting the involvement of sympathetic neuropathy and the potential role of a contagious gastrointestinal pathogen in its development. The study underscores the need for further research to identify the causative agents, elucidate the underlying mechanisms, and develop targeted therapeutic strategies for this intriguing and enigmatic feline disorder. From Vet NeuroJar, keep those minds inspired, hearts light, and tails wagging.